Today I will talk about why is tuberculosis still a global problem. So first I will do small introduction where I will talk about what is tuberculosis, causes of tuberculosis, epidemiology, symptoms, diagnosis, treatment and side effects, why is tuberculosis still a problem, conclusion and future outlook. Introduction. What is tuberculosis? Tuberculosis is a potentially serious infection disease that mainly affects the lungs. When it affects the lungs, we call it pulmonary tuberculosis or any other parts of the body, like bones, nervous system, and abdomen. When it affects these parts of the body, we call it extrapulmonary tuberculosis. The infection is more likely to develop into a disease when a person's immune system is compromised, for example due to HIV or other illnesses. Causes of tuberculosis. Tuberculosis is caused by bacillium called Mycobacterium tuberculosis. Although tuberculosis is spread in a similar way to cold or flu, it's not as contagious. The person has to spend several hours in close contact with the infected person to catch the infection. Most people with active tuberculosis who've had appropriate drug treatment for at least 2 weeks are no longer contagious. So after 2 weeks, they don't have any symptoms anymore. In terms of epidemiology, anyone can get tuberculosis, but those in a higher risk are people who are living in bad conditions, had close contact with someone who is infected, has weak immune system, for example diabetes or HIV. Some studies suggest that the person who has HIV is 19 times more likely to develop tuberculosis, who has poor diet because of lifestyle or other problems like smoking, drinking, malnutrition or diabetes. In this picture we can see that the countries who are more affected are developing countries, for example Pakistan, India, Bangladesh, Indonesia, Philippines, China and some African countries. Tuberculosis mostly affects men, around 15.7 millions. 3.2 millions are women and 1.1 millions are children. Last year, 1.5 million of people died from tuberculosis. 25,000 of them had HIV. Symptoms. Tuberculosis disease usually develops slowly, and it might take several weeks before the person notices some changes. Sometimes symptoms might develop until months or even years after the initial infection. Sometimes the infection doesn't cause any symptoms, and this is called as latent tuberculosis, and it's called active tuberculosis if the person has symptoms. However, in some cases, symptoms might not develop until months or even years after the initial infection, as I said before. General symptoms for tuberculosis are lack of appetite and weight loss, high fever, night sweats, and extreme tiredness or fatigue. In case of pulmonary tuberculosis, which is a type of tuberculosis that affects the lungs, it can cause a persistent cough for 3 weeks with phlegm, which might be bloody, and breathlessness that gradually get worse. And in case of extrapulmonary tuberculosis, which is less common type of tuberculosis, the person might have persistently swollen glands, abdominal pain, persistent headache, and in worst cases seizures and confusions. In terms of diagnosis, different types of tests are used to diagnose tuberculosis depending on the type of tuberculosis that doctors suspect. For example, pulmonary tuberculosis. Diagnosing this type of tuberculosis that affects only lungs can be difficult, and different tests are usually needed. The patient might have a chest X-ray to look for changes in the appearance of the lungs that might suggest tuberculosis, or a sample of phlegm. In case of X-ray, chest X-ray, this is how looks normal X-ray. We can see clear pulmonary edges, okay, claustropenic angles that are sharp. They're in a very good conditions, all length of diaphragm very clearly visible, and we don't see any extra shadows this X-ray. However, in this X-ray, we can see decreased lung volumes, okay, and a very clear fibrosis scars over here. That proves that it's tuberculosis. And as I said before, the sample of lung, when the person is coughing, it's red, it's bloody. In cases of extrapulmonary diagnosis, the person might have CT scan, MRI, or ultrasound scan. Sometimes might have endoscopy, laparoscopy, urine blood test, biopsy, and lumbar puncture. In case of latent tuberculosis, the person might have Mantoux test or tuberculin skin test. This test is performed by injecting 1.1 ml of tuberculin purified protein derived in the patient's arm, and the result is checked after from 48 to 72 hours. And it's based on if the doctor might see if there is any bump developed in this area. For general public, for the people who has no any risk factors associated, it's positive when it's more than the diameter is more than 15. For the people who are residents and employees of long-term care facilities, okay, or recent immigrants came from other countries, it's positive when it's more than 10. And for the people who has HIV or are immunocompromised or had any recent contact with active tuberculosis person, it's positive when it's more than 5. Treatment and side effects. Treatment of tuberculosis usually involves taking antibiotics for several months. And it can take weeks before the patient starts feeling any better. Also, it's important to make sure that the person take all course of antibiotic. If not, the tuberculosis infection might become, not infection, but the bacteria might become resistant to the treatment. In case of pulmonary tuberculosis, the patient has to take antibiotics at least for 6 months. The normal treatment usually is consistency in 2 antibiotics for 6 months, as I said before, isoniazid and rifampicin. And these antibiotics, they prevent tuberculosis bacteria from multiplying in the patient's body. And sometimes the doctor might suggest to take another 2 additional antibiotics for the 2 first months before these antibiotics, okay? In case of extrapulmonary tuberculosis, this type of tuberculosis can be treated using the same combination of antibiotics as I said before. If the patient has tuberculosis in areas like brain or heart, then initially he has to take corticosteroid such as prednisolone. Okay, this corticosteroid will help reduce any swelling in affected areas. And as I said before, complete with these antibiotics as in pulmonary tuberculosis. If it's latent tuberculosis, this type of infection is not always treated. The patient might be regularly checked in order to make sure that the infection doesn't become active. And if it does, the treatment consists either taking a combination of rifampicin and isoniazid for 3 months, or just isoniazid for 6 months. Some studies have shown consistently high protective efficacy of BCG vaccination against serious forms of disease in children. I know some countries are still giving this type of injections, for example, Ukraine and Georgia. So far, we saw that there is treatment available. It exists, but why is still a problem? Why tuberculosis is still a problem? Through my research, I found these are the most important points of why tuberculosis is still a problem. And it's mostly socioeconomic problems like poor hygiene, developing countries, drug-resistant tuberculosis, and limited access to healthcare. Pure hygiene. Hand washing is a basic strategy for infection control. This study from 2018, the study investigated the association between hand washing and tuberculosis risk at the community. The results from the study suggest that practicing hand washing is associated with decreased risk of tuberculosis incidence. So these simple strategies can help to reduce the spread and of tuberculosis. Developing countries, they have the highest number of people infected with tuberculosis because in these countries the levels of HIV are much higher. So complications such as tuberculosis is a problem because people with HIV or another illnesses, they've got weaker immune system. So they have biggest risk to develop tuberculosis. And also because people from poor countries are more likely to live and work in poorly ventilated conditions. And these conditions are perfect conditions for tuberculosis bacteria to spread. Drug-resistant tuberculosis remains as a public health crisis and health security threat. Is a strain of tuberculosis that has developed resistance to the most important drugs currently available, used to treat that are available to use to treat tuberculosis. Like I said before, in case of pulmonary tuberculosis, and there is some situation that can lead to the development of drug-resistant tuberculosis, as an inappropriate treatment, irregular drug administration that was suspended before the course was finished. Conclusions. Tuberculosis is a type of disease that is caused by bacteria called Mycobacterium tuberculosis, affects mainly poor and developing countries. Diagnosed might be from chest X-ray and blood test. We saw that there is different type of diagnosis available. Different types of diagnosis available, depending on the type of tuberculosis that the person has. The patient can develop active or latent tuberculosis. Active tuberculosis is when the person has symptoms, while latent tuberculosis when the person has no symptoms at all. And for these different types of tuberculosis, we've got different types of treatment. And as I said, these are the most important key points for why tuberculosis is still a global problem, because of poor hygiene, not just developing, because in developing countries we've got limited access to healthcare, and because of drug-resistant tuberculosis that this bug has emerged. So it's important to treat all these, reduce all these problems. How can we perform? How can we work out in order to minimize or decrease tuberculosis spread and this type of infections? In this study, this is a new study, a new combination of drug that could help with tuberculosis that is resistant to the most existing anti-tuberculosis medicine. Okay, so we are talking here about this type of tuberculosis that are resistant to pulmonary and extrapulmonary treatment. These are multi-resistant tuberculosis. The bug is multi-resistant. So, and this is these are the results according to the results of the NICS tuberculosis trial, and this trial assessed the efficacy and safety of a new 6 months oral treatment. The new regime was made up of 3 drugs, linezolid plus bedaquiline and protemonid. Okay. And this trial showed that 9 out of 10 people taking part in this trial had good outcomes. They didn't suffer treatment failure or any relapse within 6 months of the end of the treatment. These findings show that with the right combination of effective medicine, it is possible to achieve good results. Latest data from World Health Organization show that last year was spent $772 million in order to improve the studies and find new medication to treat tuberculosis. But the target for 2020 is 2 billions. So we need more investment, we need more money in order to find a cure and a treatment for this terrible disease that kills millions and millions and millions of people every single year. Thank you. If you need if you had any question, just let me know.